Hi, my name is Ravi Singh and I'm just showing a video on how to prepare DMEK tissue for a DMEK corneal grafting procedure. There are a lot of videos on how to implant a DMEK, but maybe not so many on how to prepare the graft tissue itself, which is an integral part of the procedure, especially if you don't have access to pre-prepared tissue. I've used calipers to roughly mark what size graft I need, which I measure from the patient's cornea. Now I'm using a Sinski hook to score the peripheral membrane. And this scoring technique can be tricky because if you press too hard, you get bogged down in the stroma. If you press too lightly, you don't score the membrane at all. And what you're looking for is 360 degrees of a continuous score around the membrane. This can be hard to confirm until you've actually done it and stained it with some vision blue, which we're about to do now. And there you see you've got 360 degrees scored membrane. Now I'm using the dry stout to tease the edge up all the way around. And I really spend some time doing this because that way you can pick up the membrane to create a partial peel before you trephine your graft. And I really take my time about doing this. It's very important to take your time doing these procedures because there's very little room for error in this kind of surgery. You're wanting to avoid tears in the membrane because this can make your life very difficult and sometimes lead to cancellation of the operation completely. There's a loose tag there that I didn't pick up. I'm just going to remove it now. They're distracting and also potential areas where you can get tears in your membrane. It's important to have a fully filled anterior chamber during this procedure. These operations are underwater operations, very important. You really want to use those surface tension properties of the BSS and membrane so as to avoid any tears in the membrane. Now I'm just starting a partial peel. I'm going to go all the way around. I want to feel like there's no adhesions. And I want to peel sufficiently that when I put my trephine on, the peeled area will be encapsulated by the trephine completely. And I can't emphasize how important it is to have plenty of BSS in that chamber. So I'm pretty happy with the peel at this point. Now I'm just laying down the membrane flat using BSS. I'm staining the periphery because I want to see the extent of the peel centrally, and so the membrane stains on its anterior surface. Now this just gives me more peace of mind when I come to trephining the graft, making sure that I have the whole area of peel encapsulated within the trephination area. reasonably confident that the trephine area will be encapsulated by the peeled area of the graft. I've got a 7.5 trephine here. It's important to measure the cornea of the patient to work out the largest graft that you can put in that patient's eye comfortably. If they have peripheral areas of opacification, just be careful about putting too large a graft in, because it can be hard to see your 7 mark underneath an opacified area of cornea. Now, I'm going to peel away the redundant membrane now, and this helps me be sure that I've actually got a through and through trephination. When you're trephining, you have to be careful to do a very shallow trephine. You ideally only want to go through the membrane. You do not want a full cut through the cornea. I'm just removing loose tags. If they feel adherent, don't try and remove them. Now I'm making my 7 mark. I'm not a big fan of S stamps or similar because they can fade during the actual DMEK implantation procedure and you can lose orientation. I think it's important to have solid evidence for the orientation of your graft in the eye, because sometimes it can appear that it's unfolding in the correct orientation, but it is not when you actually look at the markings that you've made in the cornea. Just removing little distracting tags. Now, under lots of BSS, we're doing the peel. That's our membrane. I'm going to stain it with Vision Blue now, but I get rid of the BSS with 2 spears. Use 2 spears opposite each other. And plenty of Vision Blue to make sure you have a deeply stained membrane.